Good morning, good afternoon, good evening. I'm Justin Brock with Bobby Brock Insurance, and I am excited to be with my friends again here on YouTube and Facebook and wherever you're watching this, learning about Medicare. Now, today I'm going to answer a question that's very important as you pick coverage or as you, evaluate what you already have and what your options are. And that question is HMO versus PPO. I don't know if you can see that over my head, or PPO versus HMO. These terms get thrown around a lot, and I think some people already have an understanding of what they mean, but maybe they don't know what they mean in relation to Medicare. So I'm going to go over that really quick and talk about these network terms. And the first thing I'm going to do is just further define them by writing out these acronyms, because they are acronyms. A PPO is a preferred provider organization. Okay? An HMO is a health maintenance organization. All right. So what does that mean? Okay? So the details are kind of right in the name in some of these. Okay? Preferred provider means that when you have a plan, most typically, notably a Medicare Advantage plan, that is a PPO Medicare Advantage plan, if you go in the network, you get PPO pricing, meaning you get pricing with less cost sharing, less amounts out of pocket for you. And those PPOs don't require you to have a referral to go to certain specialists or anything, but if you stay in there, you would typically just have a copay. A lot of times with these PPO, MA, or Medicare Advantage plans, you see them charge, $7 for a PCP or primary care doctor in network, up to maybe $25. That's kind of the common range for those primary care provider copays. Specialist somewhere between $15 to $50 for a specialist copay. Now, what happens when you go out of the PPO on these Medicare Advantage plans? Well, it depends on the plan. We've seen some that if you go outside of the PPO, they have a $150 deductible. And we've seen others that have a $1,000 deductible out of network. So the devil's in the details on how those PPOs within each plan work. But the core concept is, in comparison to an HMO, a PPO will let you go outside of the network and still give you coverage, but they'll have some higher cost sharing. It also doesn't require referrals. With a health maintenance organization, the concept or the idea is that they are managing your health, or some people call it health management organization. What they're trying to do is give you a primary care physician that's assigned to you in the HMO, and all other doctors have to be referred through them. So if you want to go to gastroenterologist, if you want to go to a pulmonologist, pulmonary or cardio, any of those, they're going to refer you to those people. And this means that this person is getting to manage all of this. They're managing it, so the gastro comes back and they're saying, oh, okay, they got this going on. Pulmonologist comes back, oh, okay, they got this going on. So that one primary care physician is getting to manage it and kind of make an analysis of your overall health rather than just each individual specialty. So that's the concept. The cons of this are you have to get those referrals, and the doctors have to be in the HMO list of doctors, that they have to be in that network. Your primary care doctor also has to be in that network. And if you do go outside of the network, typically an HMO style Medicare Advantage plan will not pay at all. They will deny the claim. A lot of times if you try to go to a doctor outside of that network, the doctor won't accept you anyway, because they'll see what insurance you have and they'll tell you to go elsewhere. So that's what we commonly see with the PPO and the HMO. So it is notable that with these, there are other types of plans, which we'll cover in later videos, like MSAs or Medicare savings accounts, PFFS, private fee-for-service. But it is notable that these are applying to Medicare Advantage plans. If you get a Medigap, a standard Medigap plan or Medicare Supplement, MS for short here, there's no network unless it is called a select plan. There are plans that operate like a Medicare Supplement that require a provider network. Those are called Medicare Supplement Select plans. But if you get a standard, so always ask if it's a standard or standardized Medicare Supplement plan, not a select plan, you can go to any doctor that takes original Medicare. You don't have to worry about these terms here. I hope that helps people understand the difference in these two. I'm not going to harp on it a lot more because I don't think it's a lot more confusing than that. PPO is obviously a little more flexible. There are some concepts with the HMO that seem to make sense for certain people. And Medigap and Medicare Supplement obviously typically at a higher price, but obviously a good option for those of you that like complete and free flexibility with Medicare. I will cover Medicare savings accounts and private fee-for-service in a later video. Talk to you guys soon.